He is married.
Center for
He's
Africa
married to
starts
his
as
honey.
a non-profit organization serving first the small community.
Like, technology is one of those spaces that thrives on problem solving, and
an organization that was
there's so many
address some of the economic disparities between the African community and the broader St. Louis community.
For Africa is here for you. They want to help you do this. We have the academies, like Claim Academy is here for you. They want to help you do this.
And so you have that
immigrants on the resources available for entrepreneurs and business holders.
I was the one who came here during winter. I almost cried in this house with the little one. But when I called, I remember when I called someone
on average per year from 75 countries.
There's something a company wants this bot to be able to do.
He's American. I said, what is your last name? That is a reminder all the time. He is not so American as he thinks. The last name. So
I can definitely assist with
for those resources, and we want to find a way how we can be able to connect those two. Those who are looking for information and those who have that information, we want to bring them together.
The persistence and the drive that I've seen.
And I grew up in the late 40s, early 50s. And at that time, the polite term of other person's African ancestry.
Should we talk about economics? I mean, I love this idea of why aren't we as African Americans
take something from this meeting and go and do something about it?
Okay, hello everyone. My name is Ifrem Oyetunji. I'm a student at WashU, working with the Faith and Vaccine Ambassadorship, where we're just trying to increase vaccine uptake throughout the St. Louis community. So thank you again to our guests who are here. Thank you again to Mr. Jeff for allowing this to happen. So we can go ahead and get started. I'm going to put a few questions in the chat just to get the ball rolling. But if there's anyone else in attendance who has questions, feel free to drop them in the chat as well, or to privately message me, and I can also toss up that question. Again, the goal for this kind of presentation is just to get your questions answered. We know that there's a lot of questions, especially as we're heading more towards the end of the summer now. And that's what we just wanted to make this available now and for later. So this will be recorded for those who are not in attendance. So the first question I will get started with is, what is one source of hesitancy you have heard that you would like to address? So that could be something maybe you've heard from the community, or something that you just know is relevant within, I guess, the larger United States. And feel free to, whoever feels ready first can jump in.
Can you guys hear me?
Yes.
Okay. So from the pharmacy point of view, I still get into contact with a lot of people, obviously. And I think one of the main points of hesitancy is the complacency among the younger group of people who are the vast majority who are not vaccinated at this point. They just feel they are strong enough, they are not going to get sick. Still, they get a whole lot of group of the younger generations just think it's something beyond them. They can't see themselves getting it or getting sicker, going on admission when they get it. So they are still like, oh, well, I don't really know how far the research into this vaccine. I'm just going to take my chances, kind of a mindset that we still have going on. So complacency is still a big thing out there right now that we're dealing with. They just think it's some way, somehow beyond them, because we actually have people who are readily looking for the vaccine, the COVID test. They once they get exposed, they know. I mean, now people know for sure there is such thing. We do have a pandemic. They just don't think they need a vaccine. So when they get exposed, they are quickly looking out for the test to see if they are positive or not, especially even if they have younger ones or vulnerable people. But for some reason, somehow they just think it's still, yes, they may get exposed, but it's not going to affect them that much. They are not going to find themselves in the hospital. they're going to write it out. So that is one group of people I'm still seeing, because I do have family members who bring in their elderly mothers to the pharmacy to get a shot, and then they will refuse to get it themselves, just because they just think I'm young, I'm strong. Yeah, I'm not going to find myself in the hospital, so I can write it out. So that's one of the big things I'm seeing right now. And secondly, to especially in the North County, in the minority and the low income group, convenience is still an issue. I still have some people coming in now because they just about now find a way of getting into a place where they can get vaccinated. So sadly, that is still an issue out there, convenience. Even though it's all over the place, some people still find it a little bit hard to move from point A to point B together. So that is some of the sad issues we still have out there. Now, I don't know if anybody else, and of course, communication too. People still have a lot of questions, so that is also making them very hesitant. We do have a lot of, unfortunately, healthcare workers who are still not vaccinated. People are now just doing it because without that, they wouldn't have a job. So meaning, even though they've seen people die of it and all that in the nursing homes and the hospitals, they still don't believe it to protect them. Of course, that factor of the complacency, they think they're strong enough, so it's not going to take them down, it's there. But it's kind of a little bit baffling, but we still have a lot of that. And unfortunately, that's a lot of Africans. We are the majority of the nurses. We are the ones working in the nursing homes, the hospitals, and most of us are still not vaccinated. Some people literally will bring their elderly parents, but the nurses in the homes are not vaccinated, which is very baffling, but it's something we still have in our community, unfortunately. Yeah.
And can I, to add to that, you mentioned the complacency there. Is there any way or anything you would like to encourage those who may feel that they can write it out, or that it wouldn't be them who's there, perhaps only the elderly should be the ones taking it, but why should young people care? Is there anything you would like to say, that maybe a question that you can imagine that they might have that you would love for to be on the recording so they can hear an explanation for that?
I think the evidence is all over the place. We have seen the reports, especially in our state in Missouri. Most people who are being featured in Springfield, Missouri are not the very old people. These are young, productive people in their 30s, 20s who are going down. And when you have 95% of those people are the people who are not vaccinated, I don't think anybody else needs to add anything. We do have a protection which we just have to get on board and just start using. A year ago, we didn't have this. Now we do. So I will encourage everybody to take advantage of that, because the COVID does not know age. That's just the fact, Yeah.
Thank you. And Dr. Tilton?
Yeah, I think the only thing I would add to the eloquent points that Rebecca has made is that there are people, unfortunately, who are still being fed misinformation. So about, COVID can cause all sorts of things, people not being able to understand how the vaccine actually works. And so some people are asking questions of like, was this vaccine developed quickly, and all of the were corners cut and things like that. I think addressing those issues will be important to getting people to basically get over that hesitancy so that they can, in fact, be willing to be vaccinated. And like she said, most of the cases that actually we see in Springfield right now, most of our new positive cases are being driven mostly by young people. And so young people can get it. And as you all know, in the news just this week, hospitals in Springfield are running out of ventilators and all that. So people are getting really, really sick. And those are not just old people. Most of the people who have been vaccinated, if you look at the vaccination rate in Missouri or even in St. Louis County, the elderly have been, by and large, been vaccinated, and the deaths have gone down in those age groups. And so it's usually these people now, the young people who are refusing to be vaccinated, who are getting sick and getting really sick of this.
Thank you both. The next question, and again, if there's anyone in the audience who has a question, feel free to mute yourself or put it in the chat. Again, this is more just a Q&A session, so we can have a space to ask healthcare professionals about the vaccine. And I would imagine this would be a very simple question. And I'm sure many in the audience have heard it before, but whoever wants to tackle it first, perhaps we may not necessarily need both. But just simply put, you mentioned the hesitancies. But after all that, why should people take the vaccine? Especially young people who perhaps maybe see the evidence, or other people who have experienced or seen and maybe subscribe to the misinformation. What information would you like to provide to encourage people that this is our path?
I'll go. I mean, we know the vaccine works. So I think that's the simple starting point. Most people who now, we've sort of, the United States is sort of like this test case. When we didn't have the vaccines, we were like the epicenter of COVID-19 across the globe. But with the rollout of the vaccines and all that, we've sort of been able to vaccinate our way out of it. And if you see, the hotspots are the places with low rates of vaccination. And if you look across the globe right now, our own homeland, the motherland, Africa, where people are suffering, is because, there are, the access to vaccines are limited. And so if we want to get back to life as normal, whatever the new normal is, right? Vaccine is really that route for us to get to that. And so, most people now, if you're vaccinated, you can get together with your relatives, your friends, and all that. So from that point of view, if you want to live a more normal life than what we've been living the last 15, 20 months, let's get vaccinated, and in that way, at least we can get. And I think young people, like Rebecca mentioned the point earlier on, young people feel very invincible. They don't think they can get really sick. I think the danger is you can bring it to somebody who can get really, really sick in the family and potentially die from that. So, is somebody who thinks, oh, I'm okay, I'm not going to die from it, that I think is just being selfish in a way, because you're not only doing it for yourself, you're also doing it for your family, you're doing it for your community.
All right, thank you. So yes, I guess another question that we'll kind of ask from there, and I think you mentioned this earlier, Dr. Tutlam, was I'm sure some that many of us had seen or had thought of before. How were they able to create the vaccine so fast? And one that I've heard several times is, wasn't it rushed? Weren't their corners cut? And feel free for either of you to jump into this.
So coronaviruses aren't actually a new thing, right? It's just this particular one that showed up in 2019. That's the new one, but coronaviruses are new ones. And scientists have been working to find vaccines for these viruses for a number of years. And so what really people needed particularly with this RNA technology, once the sequencing was done of this particular virus, once it came out of China, basically the scientists were quickly able to jump to work, because we sort of know what the map or the code of this virus was, and they were able to jump to work quickly to develop a vaccine that was specifically targeted for this one. And this work was laid over many years of work. It just didn't happen in 2019. So people have this idea that yes, from the time we figured out what this virus looks like until the time of the development of the vaccine, it was last year all the way up to the end of the year, right? So you've heard about 11 months time frame. But that isn't just the thing. People are ignoring almost 17 years of work that went into the development of a honing of the technology for us to be able to then quickly jump to develop a vaccine that was specific for this virus. So that is this idea that it was rushed, it was developed in 1 year, and all of that is really sort of a misleading notion. And so we should not be afraid to take it simply by saying that it was only developed in 1 year. The work had been going on for a long time.
Thank you. So we have another question, kind of more relevant to our present situation now. As I'm sure many have been hearing on the news about the new strain, and that is this. What exactly is this Delta variant? And is the vaccine that we're encouraging people to take, is that still effective against it? And either can feel free to jump in.
Well, the Delta variant is just a new variant. This corona vaccine, the virus actually keep mutating. So we have a new mutant variant right now going on, and which is named the Delta variant. And so that's the newest one, and that is something I'm sure the doctor can show more light, talk a little bit more about those things. And with the coronavirus, as he rightly said, this is nothing new, it's been there. This one we have now, and they keep mutating. Mostly they were not able to get into us humans, the ones that were before this one, until the year 2020 or 2019, when we got one which actually was able to affect us. And with this, it keeps changing, mutating. Even since last year, we've gone through a few variants already, and now we have one called the Delta variant, which actually caused a lot of havoc in India, as we all are aware, or mostly are aware of. So that's what we have. Yeah, so that's what we have going on right now. And but the vaccines, the 3 vaccines, are holding up pretty well against it. So that's why a vast majority, if we take the case here in the US, 99.9%, 0.6%, that's a huge number that are among people who are unvaccinated. That alone tells us the vaccines we have right now are actually doing what we are expecting them to do, or what the scientists expect them to do. Let's put it that way. So yes, we do have a new, it's just changed on us. But thankfully, the vaccines we have are holding up. They're still able to put it at bay from affecting us as we go along. Yeah.
Thank you so much. And Dr. Tillam, is there anything else you would like to add?
I think the only thing she put it brilliantly. The only thing I would add to that, you were hearing about the South African variant, the UK variant, and all that. So because people
I think we lost him. Yeah, I think we lost him.
Okay, maybe, yeah, Dr. Tillam, if you could hear us, you've cut out for us. But I think in the meantime, we'll move on to the next question. And again, feel free in the audience, if you have any questions, to privately message me if you don't want to put them there, or to put them in the chat. We don't want any questions to go unanswered, or at least unseen, because that's what this is for. So yeah, I'll then toss it off to you then, as we wait for Dr. Tillam. Yeah, perhaps we could text him on the side. I just don't know his number. But the next question that I've also heard a few times too, especially considering the timeline of the vaccine. What do we know now, based off current data, information, and such, about the long-term side effects of COVID, as well as the long-term side effects of the vaccine?
So I am just going to talk from what I've read so far, which is not much. I don't really know of any long-term side effects of any of the 3 vaccines we are actively giving right now. But then the few long-term effect, and I don't think we are in a position as to say that for a fact. But what we've heard so far is people who had the COVID disease itself are still having some of the lingering effects when it comes to lung issues. People are still not having fully recovered as they should. Those who have survived it are still having issues with if it's a loss of smell or a change in taste, or there are still a few things lingering on. And that being said, I don't really know if we're in a position to classify anything now as a long-term side effect because it's only been a year. So so doctor may be able to show more light on that. I don't know if within a year you can consider anything at this point as a long-term side effect. Again, like I said, with the vaccine itself, I don't really know of any because they were we just started. So it's going to take a few years down the line for us to have the full picture of what and if would be considered a long-term side effect of that. And that being said, we've been giving out flu shots for a while. And when you talk about at least the Johnson & Johnson, they use the same technology that they've been using for the flu shots to develop that. And we haven't had any of that much adverse effect of that over the years. So, we are all hoping it to be the same principle now. But I just think we're just in a short window. There are no data for a year or 10 years down the line. So those things we just have to live with and grow along with, and down the line we will actually get the full picture of what is going on. But that being said, we're dealing with a deadly virus right now. Our options are very, very limited. So if we have something that can put a pause on it and have us survived it, then that's what we should do. And like I always explain to people, I want to be there in 10 years to see what the long-term side effects are. The other option is dying now and not knowing. So those are where we are right now. We don't really have too much option when it comes to this pandemic. So I hope we'll all just brave it, go through and see what the long-term side effects are in the future. And we all want to make it together to find what they are. So, that's my take on that. And hopefully we have Dr. back and he can show more light on that. Yeah.
Sorry, I dropped off and I missed the question. My VPN dropped off. So.
Yes. So the question was, and thank you. The question was, what do we know about the long-term side effects of COVID as well as the long-term side effects of the vaccine?
Mm-hmm.
Oh, okay. Yeah, like I just came on while she was talking about the long-term. So, there are these people who are called the long haulers now who, still coughing many months down the road. And we don't know what the long-term impact on the lungs are. And so, there were earlier on, there were people who just like, let me get COVID and, I'll get over it. I'll be fine. But you don't know what the long-term impact on your lungs will be. There is some evidence that suggests that it may affect the lungs over a long period of time. So that is one thing. So if you can avoid getting it, so then you should do everything you can to avoid getting COVID, because you don't want to tempt fate, right? You don't want to tempt it, you don't want to get it and find out 10 years from now, your lungs are, sort of stiffen up because you had COVID like 10 years ago. So that's, I think, an important point to make. With regards to the vaccines, and so yes, like she correctly said, we don't. Obviously, the very first people who had this vaccine have only had it for about a year now. So right, and so the trials started around this earlier last year, and so we don't know what the 10-year impact of that is. But what gives us sort of some peace of mind is that sometimes when things can go wrong, you will tend to see them within about 2 months time range, 2 to 3 months time range. You will start to see some of those things that can go wrong. So we're obviously out of that window now. Obviously, people have had side effects from it and all of that. Those are expected. They were expected. There were people who were in the trials who developed some of those side effects as well. But in terms of the long-term profile, what happens 10, 15 years from now, we can't yet tell. But what we know about previous vaccines and how vaccines in general work, I think gives us some sort of idea that, maybe this will be a safe vaccine over the long term.
Fantastic. Thank you both. Then kind of going off that, so we know that the vaccine is effective. We know that it prevents death and it does all these things, and we also recognize that it is safe. But another question which we've heard a lot is, how long does the vaccine last? Will I have to take another vaccine in the fall, like a flu shot?
I think that's the conversation the whole country is having right now, including the CDC, NHS, and including the manufacturers themselves. So, so far so good. It's been a year and it's still holding up pretty well against the virus. So that's why the CDC said we shouldn't be in a rush. But then again, there are some studies coming out. We've heard of the Israel trial, the data they've collected so far, which shows that the most vulnerable, it will be in their best interest for them to get a third dose of the Pfizer vaccine. So again, the scientists are doing all they can to be collecting data and just making sure we are on top of this as much as we can. So again, nobody knows, including Fauci, as to how long these vaccines will last. But they've all assured us that they are collecting data, they are actively collecting data to see as in when we will need a booster dose, we will know. So again, like everything with this, the virus and the vaccine, time will tell. I think that's where we are right now. We're just thankful the scientists are on top, including the pharmaceutical industries, and making sure we're at least keeping this at bay. Again, we all have to remember that we're just not dealing with the virus keep mutating. So that's the biggest, I think, problem we have going forward. So we just have to work with it. And our scientists are doing all they can just to make sure our efforts and that we are all putting in is not going to waste. We are able to win this battle against the virus. So for now, we do not know how long that vaccine will last. And but everybody is doing what they can, including the manufacturers, to let us know as soon as possible if we need another dose, which will probably put it at a year, since what they are targeting, at least in Israel right now, those people are getting closer to the year mark that they intend to revaccinate again. So give and take. So that is telling us it's good for about a year right now. Should they go ahead in the fall to start giving a third dose? Yeah.
Okay, thank you. I have a few questions coming in privately. The first of which has to do with those being vaccinated and their ability to spread to others and the rates of that. So I'll drop that in the chat. The question is, since the vaccinated people are getting COVID-19 and remain without symptoms, are they as infectious with the virus as those who are unvaccinated?
So I think the evidence suggests that people who are vaccinated are less likely to transmit or spread the COVID-19 compared to the people who are not vaccinated. And so this is why people are being encouraged to, get the vaccination, because, if you don't have protection, then you are less you don't have protection, then you are obviously more likely to spread the virus if you get it, versus the people who have not who have been vaccinated.
Awesome, thank you. And the second question, and again, feel free if you have another question to privately message me or put it in the chat. The question is, how soon do we expect kids under 12 years old to get the vaccine approved?
That's a good question. I think the trials are going on right now, and so they'll probably be submitting. I think we were expecting sometime by the end of the summer they'll probably be submitting data to the FDA to look at, whether these kids younger than 12 can be vaccinated. I believe both Moderna and Pfizer began trials in kids as I think as young as 2 years old or something like that, and so those trials are going on, and so it's a matter of collecting that data and submitting it to the regulatory agencies to look at, okay, is it, so we know for the most part it is safe, and so I guess it's a question of determining, dosage and all of these issues that have to be worked out among younger kids, and so once that data becomes available, then that determination will be made by FDA. Yeah.
Perfect, thank you. And the next question we have, excuse me as I try to copy it into the chat, but it's kind of getting at the mechanisms that we know of how these vaccines work. We know that there's two ongoing technologies in use, at least here in the States. One of you mentioned the mRNA vaccine, and the other mentioned the Johnson & Johnson vaccine, which you mentioned was similar to the flu shot. So just to kind of get at that question, how exactly does an mRNA vaccine work? And how is this different than the Johnson & Johnson vaccine? And I guess maybe a final question to tack on that. Does it really matter which one I take then?
I think first response is that I think you'll take the last one, and you can chime in. You're probably more aware of this than I would be. So any vaccine that the first vaccine you can get your hands on, please get it. There are advantages and disadvantages, obviously. So the Johnson & Johnson vaccine, obviously, is a little bit more accessible. It's obviously only one dose shot, and so it's much more accessible to a lot more people. And so the first one you can get your hands on, please do. My mom, I took her. She got the Johnson & Johnson one, and I think we got the very early one before the Johnson one came out. Obviously, only Pfizer, I think, was available at the time when some of us got vaccinated. And so the first one you can get your hands on, please get it. So I think they all prevent you from ending up in the hospital. I think that's the most important thing. So in terms of the technology, and it was mentioned earlier on, so the Johnson & Johnson one obviously uses this similar technology as the ones that we've been using previously. So I think use what's called the adenovirus. They basically, and the way vaccines are made initially. So, I mean, if I could just go back to give you a good example. So what do vaccines actually do? Some of us are familiar, a lot of people are from Kenya here. You run a marathon, you don't just, you're not just like me, you've been sitting for a year and then you go say, I'm going to go run in the Olympics, right? And I'm going to go compete against these world-class athletes. You don't do that. You're going to break a leg, you're going to do something terrible, and you're probably going to not going to be able to run a mile. So you have to train your body for that endurance, to be able to run the 26 miles and all of that. So vaccines really, that's what they do. They train your body to respond to whatever adversity comes into your body. So our immune system has a very, very good way of recognizing intruders, right? So whether it's the flu virus, whether it's the coronavirus, whether it's whatever virus comes in, our body naturally responds to it and all that. The only problem we have is that, so by the time your body figures out what has, the thieves that have invaded your body, basically it's almost too late, right? It takes time, it takes process for it to recognize it, develop the tools to be able to respond to it. So these vaccines are developed to help your body train that. So coronaviruses, I don't know if you've seen those pictures of coronaviruses. They have like this quickly spikes that have appearing. So those are what are called against the spike proteins, right? And so the mRNA vaccine is basically you take the RNA of the coronavirus itself, and then you're not even taking the virus, so you're just tricking it to be able to make that spike protein. And so it mimics a spike protein that a coronavirus would make, so that when your body sees it, it knows that this is a foreign material. It develops the antibodies to help to bind to it, so that then it can be destroyed. And so that when the actual coronavirus itself comes into your body has already seen it. So our body is like, that one person who holds a grudge against everybody, right? So I remember what you did to me like 10 years ago. And so then your body is able to quickly respond to that, because it's holding a grudge against this particular intruder that has come, and then it's able to destroy it quickly. That's why you don't even feel any symptoms. Coronavirus may come into you, your body jumps into it, I've seen you before, destroy you, and then you move on with your life. You may not even feel it. So that is the new technology. In the past, like the flu viruses and all that, what they do is they take the actual virus itself, they sort of modify it, or they kill it, or they reduce its lethality, so that then your body can develop those proteins against it. And that's how basically this what do you call the adenovirus works. And then the next process is the same. So your body develops antibodies against it, and then it kills it, so that when the real one comes, it looks exactly like what the body has seen before, and then it kills it. So that's the biggest difference in terms of the technology. We already talked about because it uses this adenovirus, it's a little bit more stable. So the RNAs are not as stable as this one. That's why you have to cook. Store them in very, very cold temperatures. And Rebecca probably knows this better than I do. What sort of refrigerator do you need to be able to keep, these vaccines and all that? And I'll let you take over from there.
Oh, all right. So I'm talking about the storage, right? Yeah, okay. All right. So, when it comes to the Pfizer vaccine, we have to store them under sub-zero temperature. They've done a whole lot of work now. It's getting better in terms of storage, but we do have to store them under sub-zero temperature. So for us, they actually had a container that we can buy dry ice, which helps us to maintain that temperature. And the process is well intake. It comes with a thermometer that is monitored on site from a different state altogether to make sure it's being stored at the temperature that it is. There's a controller, and they check on it every week to make sure, and that it's, on daily basis, sometimes several days in several times in a day, the temperature is being monitored, and you get an email that you know where it's at. It's battery operated. You have to make sure you charge it, and so it's able to do what it's supposed to do. So what we do for the Pfizer vaccine is we get dry ice. That's how you are able to keep it at the sub-zero temperature, and you're able to move it to the freezer for 2 weeks. And by now, the good news is, even with the Pfizer vaccine, you can actually store it in the refrigerator for 30 days. So now things have actually improved, and it's making it more accessible. So you have the sub-zero container that you can actually maintain that temperature in. Of course, the bigger hospitals, they actually have a freezer which maintain that temperature. But luckily for us, the small pharmacies too, they do have a specialized container for us that all we have to do is to get in the dry ice and be icing it and then maintain that temperature, which has been very great for us. So that's that. And when it comes for the Moderna vaccine, you can store it in the freezer. It's good for up to 6 months, which is also equally great. And then you can keep it in the refrigerator again for 30 days. So that's awesome. And but when it comes to Johnson & Johnson, again, being an old technology that's been tried and tested for long using other vaccines like the flu vaccine. So that is purely refrigerated. You just keep it in the refrigerator until the expiration dates on the vaccine. So that's how we keep those vaccines, and those are the differences now when it comes to the storage of them. Again, we can't stress it enough. Whichever vaccine you get, please go ahead and take it. They are all equally effective, and they are all doing what they're supposed to be doing, at least We are almost a year into it right now, and the evidence is still there. So please go ahead and get whichever vaccine you have available to you. That being said, most places, including my own place, we do have all three options available all the time. And one thing too we need to know is when it comes to the vaccines, when you take, please make sure you are completing the series, because all the evidence are based on you getting those 2 doses. So if you only get half, you haven't quite finished the job. Your training is not complete, so you're not going to make that marathon. So it's very, very important to get your second doses in as much as you can. If you know for a fact that you cannot just be available for those 2 doses, then go ahead and take the Johnson & Johnson. And one other point is it's never too late to get your second dose. So if you mix it, you're not going to start all over again. You're just going to continue. So please, if you mix it, if you're a month off, 2 months off, don't worry. Go back in and get your second dose. So missing it is no excuse. Don't worry about that. You're not going to start from scratch. You just continue wherever you left off. So please, let's make sure we finish the series. Yeah.
Thank you both so much for that. I believe that level of detail was very necessary to really just know what the vaccine is, the technology is, from start to finish. And funny enough, in your closing statement there, we had a question, whereas if I, that was DM'd, if I got laid for my second vaccine about 7 weeks, should I consider it a waste, or will I still be fully protected? And I believe you just answered that. Just please take it.
Yeah.
Something I would also like to emphasize, which I'm sure both of the professionals here are aware of, is like the vaccine is also free. So whatever you have access to, please take it. There's not one is not more expensive than the other. You do not need insurance to take the vaccine either. So if you are able to gain access to it, please do so. I believe they're right now trying to take away as many barriers as possible. Especially I'm hearing the news about how accessible the freezers and the refrigeration was, because I remember hearing those stories early on about that being a difficulty. But I'm glad to see that that's where we're headed now. We're kind of running into one of the last question I have, at least. We're running into an hour here. So if anyone has any last questions, feel free to put that in the chat or to DM me. So that last question is, what exactly, for you guys have each hinted at it along the way, what led you to trust the vaccine for yourself, for your family, for the people you take care of? What convinced you? What was reason enough that I'm going to take this, and I'm going to encourage others to take this as well?
So yeah, I'll go first. So I mean, we're scientists, so we believe in science. So I think we've answered some of these questions. So some of the questions that the people took, people took shortcuts. We know that nobody took any shortcuts. We know that this vaccine technology has been in development for a long period of time, and so that gave us some additional assurance that is in fact no corners were cut. When you look at its efficacy, it reduces your risk of getting COVID-19. So looking at the alternative, particularly for people with, if I don't know if you all know, everybody, it's been in the news, it's been all the statistics there. COVID-19 disproportionately affected African Americans in the United States, and all people of color disproportionately. There we can spend a whole hour talking about why that is the case, but that's a discussion for another time. And so basically the vaccine, for me at least, was something that, hey, if I want to be able to protect myself, my family, and my community, this is the best way for me to protect myself and my community, because the alternative is getting COVID. And we know that even as very young people have died from COVID. So you can't use age as your sort of your trump card, like no pun intended, you know, to protect yourself against it. And so I think with all of this information that is available, I at least personally felt comfortable that that it was safe. It was, and you know, I got my first vaccine in January, I think the end of January. So it's almost how many months into it now. I keep telling people I haven't grown any horns, I haven't grown any tail, you know, and so and so I think I'm still okay, and thankfully I haven't gotten COVID, and so that's, I think for me is very reassuring.
Yeah. So I think Dr. just put it very well in the, I mean, ironically, you know, we have the flu pandemic to look out to, and it's okay to have questions, even when it comes to wearing masks and things. Reading back as to what happened in 1918, the same problem. People fought that, they fought the vaccines, it killed people, most people were hospitalized, and we have the same thing again. So I think we are of a little bit of an advantage. If we just go back and read 100 years ago, they went through the same process. People have questions, but somehow the flu vaccines have been able to hold, and it has been preventing disease all these years. So that kind of make it easier for me, myself. And then coming from Africa, we have been giving shots all our lives. Before we came here, you have to get your yellow fever vaccines. You're not moving anywhere without the vaccines. So people like us, we used to vaccines. I had my dad, he went through the polio, and he still tells us the tales of that. So we know what vaccines have done. And personally, that made it a lot easier. And being, I'm a pharmacist, of course, and I get a flu shot every year. So since I came to this country, and thankfully, knock on the wood, my household we've been preserved. That of course, people do sometimes they get a vaccine and things still happen, but the evidence are there that vaccines do work. So I'm encouraging everybody to get it. And having questions is nothing new. It's always good to question things. It's always good, and you want to be comfortable before you do anything. Like we said in pharmacy, there's just a very thin line between poison and drug. That is a fact. Even aspirin we take has issues. So it's okay for you to be comfortable before you do anything, but just know for a fact that the evidence are there. So even forgetting about the 1800s, even now with the Delta variant, what do we have? The 90% or 99, I mean, the percentage is out there that people who are being hospitalized now, currently, as we're going through this whole process, are people who are not vaccinated. So I think the evidence is out there. It's clear now that this vaccine is doing something. So I will encourage everybody who is still sitting on the fence to, go ahead and take this protection so we can quickly come out of this and then get back to life, normal life, whatever it's going to be for us in the future. But that shows the evidence are out there that the vaccines are doing what we are expecting them to do. All you have to do is to turn on the news and hear about Springfield, Missouri, and the evidence is out there. So please, I'm encouraging everybody, if you're still sitting on the fence, to go ahead and get it. If your kids are 12 years and above and they have not received it, please go ahead and get it. Because I do have some parents who have themselves taken the steps and they're still holding up on their kids. So yeah, I'm encouraging you. It's safe, it's safe. My kids have received it. We are all doing well. So I encourage you, if you have kids who are 12 and above, to go ahead and then take that step with them as well. Yeah.
Thank you so much for that. Thank you. We did get one more question, privately messaged to me, kind of going a little bit to what you mentioned there about the Delta variant and such. Wait, sorry, give me 1 second. Okay, I'm seeing, so it's kind of a follow-up to the question. So why are some people who have been fully vaccinated testing positive with the Delta variant? They also mentioned the cases, one had tested positive while the other did not. However, one tested positive while the other is not. Both took Pfizer. So I guess the question is kind of getting at, why are people who are vaccinated still testing positive? What does that positivity mean? Are they, for example, ending up in the hospital? Like, what is the data showing of those being vaccinated and their possibility of being positive?
So I think the good news is, and this is part of the reason why we are encouraging people to be vaccinated. There are what are called the breakthrough cases, right? So we remember we say that vaccines are 95% effective. So it's not 100%. So there's always going to be a small chance that you could still get COVID. The good news, at least from the data I've seen even locally here, is that if people who have been vaccinated and have these breakthrough cases actually have either no symptoms or very mild symptoms of COVID-19. So it then gets to that point again. You never know. If you didn't get vaccinated, this person might end up on a ventilator. But because they are vaccinated, and now they just have mild or no symptoms at all. And so it's still conferring some level of protection from you having really, really bad outcomes. And so, yes, we do acknowledge and we do recognize that there are these so-called breakthrough cases. And even here locally, we do have them. But for the most part, these are very mild or no symptoms at all. So that at least the vaccine is giving you some sort of protection there.
Perfect. Thank you so much. I believe as we are seeing now, I believe all the questions have been addressed. If there are any more questions, feel free to unmute or drop that in the chat to me or to the general chat. So I guess with that, then I'll just kind of hand it off to Mr. Jeff. But again, I think what we're kind of just going for here is, as was mentioned before, we know there are questions out there, and it's perfectly okay to have questions. But we are just here to provide as many answers as we have the evidence to back up at this moment. And of course, that's just what we're here for. So if there's any way that either me or I'm sure the other attendees here can be helpful in getting you access to the vaccine, or answer any more questions you wanted to ask privately, I'm sure we'd all be available. And Mr. Jeff could put us in contact with anyone who may request that. So yeah, again, thank you to both of our guests here. And I'll just hand it off to Mr. Jeff to close us out for the night.
Jeff, before you come, can I just chime in a little bit? So yeah, thank you, Ephraim, for moderating this session. We can't stress enough for people to get vaccinated at the County Department of Public Health. So if I may put that hat on right now, we are literally begging people to get vaccinated. And I think in the very near future, we are probably even giving people incentives to get vaccinated. And the county council, if you've seen the news last week, allocated a whole bunch of money. We just got another additional bunch of money on Friday to be able to go out into the community to get people to be vaccinated. And we are doing that because, we want our community to be protected. We know what we hear and we see what is going on in Springfield right now. Our colleagues who are down there talk with us on a regular basis. It is terrible. And we don't want to get back to a situation like that. And that is a situation that is avoidable. If this happened in the middle of 2020, before we had the vaccines, maybe you can say there isn't a whole lot you can do about it. But what is happening right now is completely preventable and avoidable. I mean, I feel sorry for our folks back home because access is a big issue. And so you can't really blame people for this third wave that is happening in Africa. But here we have access to the vaccine. I have a niece who just came from Kenya. We literally just walked her over as soon as she got off the plane and she got vaccinated. So if anybody can get vaccinated in this country, and so you should take advantage of that.
Thank you so much. I think I appreciate Ephraim. That was a great way to be able to moderate, and we appreciate you. Thank you, Dr. Nihal, Dr. and Rebecca. like I said, I appreciate you guys for all the great work that you've been doing since COVID and even before. These forums are great because every time I come to these forums, I learn something. Every time I'm in these forums, I'm learning something. And I see the same, even the people who have been in the audience. We come to these forums and we invite people to these forums because we feel there is still some information that people haven't been able to receive, or maybe people have some questions that maybe they have not had a better way to get their questions answered. And like Dr. Nihal and Rebecca said, is that for now, I think we know COVID vaccine works because if you look at the graph, it has changed a lot. I went to church today and I'm looking around, people just they're just getting back to normal. They're just getting life back to normal. And I think even just that mental awareness that you feel like I got vaccinated, I'm safer. It may not be 100%, but I don't need any evidence to see that with all this fear we had before and all the numbers that we were looking at before, and now people are just going without masks and still we have the numbers low. I talked to the doctors who are working at the hospitals and they say they don't have all those serious cases that they used to have before. So, it's enough. And I think also like the speaker said, if they're talking about the numbers of people who are at the hospital, who are getting hospitalized right now, the highest number is people who have not received vaccine. The highest number of people who are dying are the people who have not received vaccine. So if there is a way that you can be able to look at it and say, you know what, I need to take care of yourself. And I think like, I don't know, is it Rebecca who said, Dr. Nihal, he said, not getting vaccine because you think you're healthy. I think it's more being selfish in a way, because you could be able to spread that to somebody who could end up in the hospital, or maybe who can be able to maybe we can lose them because of this. If you taking vaccine is not just for yourself, it's also for the people around you, because we want to be safe and everybody want to get their normal life. We all want to go back to our normal life. We want to get our normal meetings and start enjoying those great moments of social moments. So, and I think we all know, I was just reading in the news, only 1% of people receive vaccine in Africa. Not that they don't want, it's because they don't have access. But here you have access, you can wake up, I know, and I appreciate Rebecca, you have, and Dr. Nihal with what you have done with your office. You can just wake up and watch your vaccine. And like Rebecca said, if you cannot be able to get both, just go get the one shot and you're good. You're good to go. So let's not take for granted what has been available for us. And it's free. If they were charging, then that would be different, because people will not be able to go for it. But now it's just free. V4A for now, we have actually partnered with different agencies around. If you cannot be able to, if you know somebody who needs vaccine and cannot be able to travel, need the transport, let me know, and we'll be able to make arrangement for them to be transported from where they were, wherever they are, and if they go for the next session, for the next dose, we will make the same arrangement. And like I said in the chat, just go ahead and please reach out, share this information with your people. Talk to people, help them address some of those questions that they have. Because sometimes when you yourself, you talk to them, they may be able to listen to you. Then they would be able to listen to us, because there are people that we may not be able to reach. There are people who have questions, especially those who have language issues. You can talk to them in a language they can understand. And if they need somebody to talk to, or we need a way we can be able to reach out to them, feel free to reach out to us. Rebecca office, maybe Rebecca, you can post your address on the chat, and you can be able to, people can be able to make appointment. They don't actually need to make appointment, you just walk in. And I think also at St. Louis County Health, it's also open for people to walk in. It's good to know that you can just go there and get your vaccine.
My name is Nicholas Ngige.
My name is Sebastian.
I am Patavi. I'm Grace Marianganga. I'm Ruth.
Diane Stevenson. Jen McGaddy.
Samilka Dewa.
Christina Vivid.
Safi Uzaye. Jaja Uzaye.
Agatha Kinethia.
Faiza.
Dr. John Mwangi.
My name is DeAndrea Weeks, and I am with Vitina for Africa.
I am with Vitendo for Africa.
And I am with Vitendo for Africa. And I am with
Vitendo for Africa.
I am with
am with
Vitendo for Africa.